Meet Georgia Balanay, a 15-year-old teen mom in the Philippines. Georgia is one of many teen moms in the Philippines, where about 500 Filipino teenagers become mothers every day. It's a moment that changes lives forever. But it doesn't have to be the end of today's story. Let's explore how we can support and empower teens facing unexpected pregnancies. In 2020, just over 158,000 babies were born to females ages 15 to 19. Most teen pregnancies are unintended, but many adolescents don't have access to information and services to help them delay or avoid pregnancy. Some challenges adolescents face when they have babies before they turn 20, compared to older parents, include being less likely to finish high school, more likely to have low income as adults, and as a result, more likely to have children who face challenges like poorer educational, behavioral, and health outcomes. In our country, 5,774 children were born to adolescent girls aged 15 to 18 in 2021, according to the National Statistics Bureau of the Agency for Strategic Planning and Reforms of the Republic of Kazakhstan. Talking about the effect of pregnancy to the teenager. First, anemia. Pregnant teenagers are prone to anemia due to nutritional deficiencies. Second, difficult labor. Teenagers often have smaller pelvic cavities, leading to obstructed labor. This increases the likelihood of needing tools like forceps and vacuum extraction to assist in delivery. And lastly is high blood pressure. Pregnancy-induced hypertension is common in first-time pregnancies, including teenagers. It can lead to complications like preeclampsia or difficulties, which is dangerous for both mother and baby.
Now let me have a word. Thank you, LDR. So, as you've already mentioned, the problem of teenage pregnancy is pretty relevant in today's society, and this means that science must use different tools to counteract that, right? Right. Now, let me tell you about some scientific solutions that may help in solving this problem. The first one. Imagine a procedure shrouded in gravity and precision, a surgical method to remove a fetus from the mother, often a standard practice in abortions. A surgical procedure designed to remove a fetus from the mother, a common method of abortion, might sound a bit odd at first, but it's far from amusing. While the process can be daunting, the end result remains consistent. The developing fetus and the placenta are carefully extracted from the uterus using a tube inserted through the cervix. Science is really magnificent. The second one. As abortions are often performed in the late stages of pregnancy, particularly at the end of the first trimester and the beginning of the second, emergency birth control pills are also an option. One of the safest methods involves using copper intrauterine devices, or in short, IUDs. In simple terms, this method places a small device wrapped in copper inside the vagina. The copper creates a hostile environment for sperm, preventing fertilization. However, this must be done within 72 hours of sexual intercourse. The main method we want to focus on is the abortion pill. As the name suggests, this approach involves taking medication to end a pregnancy. Two key drugs are used, mifepristone and misoprostol. They have some similarities but work in different ways. Mifepristone blocks the receptors for progestins, which are hormones essential for the uterus to grow and for the fetus to develop. Normally, progestins prepare the lining of the uterus to support a fertilized egg and help it grow. According to the Planned Parenthood website, by blocking these hormones, mifepristone stops the embryo from getting the nutrients it needs, leading to the termination of about 70% of pregnancies. Misoprostol works by softening the uterus and causing it to contract, which expels the embryonic tissue. Although this can result in significant blood loss, it is still considered relatively safe. Memorial Sloan Kettering Cancer Center suggests that when used together, these medications are about 98–99% effective, while misoprostol alone has a 78% success rate.
Abortion pills that are widely accessible can make it easier for people to get safe abortion services, especially in places where there are few medical facilities or stringent abortion regulations. This accessibility can reduce the number of unsafe abortions, improve health outcomes for women, and uphold their reproductive rights. However, the massive use of abortion pills could contribute to a declining fertility rates, which can have long-term social implications, such as an aging workforce and potential labor shortages. While abortion pills empower women to make choices about their pregnancies, a significant decline in fertility rates may pose challenges for societies facing already low birth rates. This demographic shift underscores the importance of balanced reproductive health policies to ensure population sustainability.
What do we have in the end? Pills that allow for a painless way to terminate a pregnancy, saving a lot of money. While the issue of birth rates can be compensated by the fact that people can have children when they're a bit older, more responsible, and ready for parenthood. So, is it a win-win situation? Well, at the end of this discussion, it's important to remember that a fetus is also a human being. So, in any case, terminating it is inhumane. However, if there is no other choice, such sacrifices may be necessary. Nevertheless, it's best to avoid such situations by preventing early pregnancies. So, think rationally and be aware of the possible consequences of your actions in life, so you don't end up struggling with them in tears later on. Cheers, mates!